Hello, everyone, and welcome back to another Cars Reading Skills workshop as part of the Jack Westin MCAT podcast with your hosts, Jack Westin and Molly. Jack, I'm so excited to have you back again, once a week, coming at you with a amazing Cars passage from our website. This is a pretty fun one. I'm excited because it's related to things that a lot of students care about, being pre-meds and individuals and interested in pursuing maybe public health.
Yeah, awesome to be here again, Molly. I love doing this with you. This passage is very easy to read, right? But one of the things I always tell students is if it's easy to read, they can test you on any sentence, right? Every sentence is going to become very important. And there are a lot of lessons we can learn from this. So I'm excited to jump in.
Yeah. So if anyone here listening is new to our reading skills workshops, know that we will be going through one of our CARS daily passages from our website and our question bank. This one in particular is called Teenager Health, and it's the daily passage from July 30th. So if you are listening to this on July 30th, you can always navigate to our website, jackweston.com, and it'll be displayed right there on the homepage. You can click on it and access the screen that's being shown. You can check out the passages as well as the questions. If you're listening to this after July 30th, no problem. We've got the link to the passage in the description. We encourage you guys to take a look at the passage before listening, since ultimately we're going to go through this passage sentence by sentence and talk about what information is critical, right? What information teaches us about the author's perspective, and then what information may not be critical, right? Maybe it's saying the exact same thing that came before. Maybe it's totally random. Maybe it's just a fact. We'll talk about how to deal with that, dichotomy essentially between things that are really important and may not be quite as important. So if you haven't read the passage, grab that link, give it a try. And then, of course, after we're done pulling out what we need to from each paragraph and talking about what the main idea is, we encourage you to navigate again back here and try the questions. So you test your knowledge and ultimately get practice with the application of the CAR strategies that we'll discuss. So I'm super excited. Again, teenager health, pretty interesting, very relevant topic for many of us that are interested in pursuing either medicine, which should be all of us, or even public health topics. So I'm pretty excited. Jack, are you ready?
Yeah, let's do it.
All right. So let's hop in. As always, we'll start right at the beginning. Sentence one of paragraph one. It says, analyzing the health status of the school-aged population is a classic case of a good news, bad news scenario. Okay, interesting first sentence to give us context. We're talking about the health of school-aged population. So I'm thinking like elementary to high school. That's what I would think of as school-aged. We'll see if we get more specific. But their health is good and bad. There's good aspects, there's bad aspects.
Right. So that sets the tone, right? Okay, so we're not always going to just talk about the good stuff. We're not going to just talk about the bad stuff, everything. And this is the topic, right? Health
Mhm.
of school-aged children or population. So this was even though there wasn't a testable idea in this sentence,
Mhm.
so general, it establishes what we're talking about, right?
Yes.
Which is super important. The context is going to be very important.
Yeah. I love that you bring that up because so many people think the first sentence always has like an argument or the most important argument,
Right.
but
Yeah, it's
sometimes
not
it's context.
necessarily, yeah, it's not necessarily gonna be something that you will be tested on, but it's always important. The first sentence of the very first paragraph is super important because it sets the context for what we're
Yeah.
talking about, which is really important to find those big ideas later on.
Yes, absolutely. Great advice. All right, let's look at our next sentence. It says, compared to other age groups, school aged youth are among the healthiest segments of the population. So this sounds kind of like maybe a good aspect, right? They are the healthiest segments of the population. That's an argument, right? So school aged youth are the healthiest, right?
Yeah.
Compared to other age groups.
How would
Pretty
we ever know?
straightforward, but
Yeah, but how would we ever know that? Like, how would we know that they're actually the healthiest? It's not like we have something that can monitor them 24/7 and monitor everyone in the world, everyone in that the other populations, right? The older the
Hmm.
seniors, for instance, to compare, right? So this has
Hmm.
to be an argument because there's no way we can ever test this directly. It's not factual, right? It's
Yeah.
more of an opinion, even though it looks like a fact, right? Like you would assume it is a fact, but it's not because when you think about it, it's like, okay, well, how would we ever know for sure?
Yeah. It's like, what does healthy mean to you, author? Like, healthy is kind of arbitrary. Like, does it mean that you have the lowest risk of disease? Does it mean you have the lowest risk of, like preventable death? Does it mean that you have the highest joy? Like, what is healthy?
Right.
That I think is part of what makes this it's an indicator of the argument. If it had said school-aged youth have the lowest rate of chronic kidney disease of any age, okay, cool. That's like
Yeah,
maybe something you
that's
could measure, but this is
right.
not measurable.
Yeah, that's a great point. Like, how do you define healthy, right? Because healthy could be how fast you can run a mile, right?
Yeah, exactly.
We
It
don't
could be
know.
anything.
We have no idea. So that's a really good way of looking at it too. Awesome.
Yeah. Okay, let's look at our last sentence of this paragraph. So it says, the overwhelming majority of them will not only survive to adulthood, but well beyond the mystical age of 60 and 10. 60 and 10. Is this Abraham Lincoln's speech? I've not heard 60 in a very long time. But okay, right. From the things that are clear to understand, we're saying that they're going to survive for a long time. Presumably, they're pretty healthy. Um, so
Yeah.
they're long lived.
Right. Three score probably means either three, like probably 20. I mean, I can't imagine it
Yeah,
being
I think
20.
it is 20. I think
Yeah.
it means so 60 and 10. I'm pretty sure that's 70,
Yeah.
but that's
Three.
not common knowledge.
Right. No, no way. I mean, as long as you know it's an old age, then you're good, right?
Yes.
Mystical age, like probably really old, right? And back
Hmm.
then, whenever this was written, that's probably old,
Yeah.
right? Nowadays, that's not even that old,
Yeah.
right? Okay, cool.
Yeah. And survive to adult, not only survive, but well beyond.
Well,
Well
yeah,
beyond adulthood. They're old. That's
there you go.
the
So don't freak out if you don't know what three score and 10 means because we don't know it either, right? It's just more about understanding the message is okay, they're living longer. Okay.
hmm Yeah. So is that the message we pull out of paragraph one? What do you think? If we had to summarize it for our audience here, what is important about paragraph one?
I would just say that school age youth are the healthiest population. I mean, that's really the only message the author's been trying to tell us so far.
Yeah, fair. Okay, so sentence two ended up being pretty important. Okay, well, let's take a look at our next paragraph and see. Again, we started off with the good news, bad news. We kind of got the good news. They're living long.
Right.
Let's see what else we get. So, paragraph two says, however, there is substantial reason for serious concern. So, we got that. However, I know we always talk about the but yet and howevers, those contrast words that we talk about that change the direction of the argument. Here we see it. Now we're talking about serious concerns.
Right.
Um, so, probably getting into the bad news.
Yes, and this again is not testable because it's not specific enough as an argument. It's just saying there are concerns.
Mhm.
We anticipate that the author in this paragraph, hopefully, will, and maybe other paragraphs, will explain those concerns.
Yeah.
So we have to keep reading for the actual specific message, and sometimes that won't happen until later on in the paragraph. So there's going to be filler, right? To the way I want you to look at it is the author has to talk in a way where it builds, right? And don't fall for the building part, right? Like try to focus on the part that really clarifies the message. And so
Mhm.
you have to keep reading to find that message.
Yeah,
Yeah.
absolutely. Okay. So the next sentence says this concern is highlighted by the National Commission on the Role of the School and the Community in Improving Adolescent Health in 1990. Bit of a mouthful there, was a joint effort by the National Association of State Boards of Education, or NASB, and the American Medical Association, or AMA. So we're basically stating that a bunch of these commissions and experts also are concerned, or they were the ones who highlighted the concern.
Right.
Cool, kind of
I would
filler.
Yeah, this is all filler. This is all building onto what is really important, right? Now you may think,
Mhm.
oh, what about all these different organizations? Do I need to track that? Not really. I mean, just as long as you visualize it, you knew it happened. I don't think this is going to ever be tested. Maybe the date is important, like 1990. Okay, this is back like what, 30 something years ago.
Yeah.
So like 35 years ago. So I would just keep track of that, right? So I would just keep track of the date and just keep reading, right? Because the message is not clear yet. But we did see that contrast word, so we know something bad is probably about to come up. Okay.
Mhm. Yeah. Okay, so in their commission report, Code Blue Uniting for a Healthier Youth, they stated, quote, first, never before has one generation of American teenagers been less healthy, less cared for, or less prepared for life than their parents were at the same age. Yet, in many respects, that is the case for adolescents today. Okay, I feel like this sentence actually really does give us a serious concern, right? It sounds like what we're saying is this generation is not less healthy than other populations in this moment in time, but less healthy than school-aged populations used to be in the past.
Right.
So
Right.
this age group in this generation is less healthy than it should be.
Right. Even though it's still the healthiest
It,
among the
yeah.
population.
Like
Right.
a 14-year-old still gonna be healthier than a 74-year-old, but a 14-year-old today is less healthy than a 14-year-old 40 years ago. That's what
Right.
I'm getting.
Yeah. So the thing is with contrast words, is when we think of it, it's kind of a flip, right? I mean,
Mhm.
the previous paragraph mentioned how they're the healthiest, so you would assume that they're going to talk about how they're not healthy to some extent, or maybe there's some other issue with them. Maybe they're the most depressed. Who knows, right? There's something going on, right? But that's just a clue that it guides us if we want to think of it that way. This
Mhm.
Both statements can be true here. You could still be the most healthiest population, right? The school age children could still be the most healthiest, but they could also at the same time be the least healthy ever in for their own generation. So yeah,
Mhm.
very clear, very straightforward. You need to understand both arguments, the first paragraph and the second paragraph, and understand that they both could coexist at the same time.
Yeah, absolutely. Okay. So let's take that into paragraph 3. Let's see what else we say. So, school aged youth have always faced challenges, but unlike previous generations, never at such epidemic levels. Okay, that's a pretty extreme way to phrase that, right? We're stating, yeah, there's challenges, there's reasons for concern. This has always been the case, but it's now at an epidemic level. This language makes the bad news scenario seem a lot more intense when
Yeah,
I'm reading this.
yeah, you could kind of link it to the previous paragraph, but we are
Mhm.
talking about it in a unique way, right? This
Mhm.
academic level, which is very, it's not necessarily extreme, but it's a very, very, yeah, opinionated point that we need to keep track of.
Yeah, it's a strong argument, not an extreme
Right,
word.
right.
Um, Although we do say it's never at such epidemic levels.
I guess you could say it's extreme. Yeah. It's weird because when I think of extreme, I usually think of the tone,
Yeah.
right? And the tone here, I guess you could say is pretty extreme, but usually when I think of tone, I think of the way the author communicates their argument in terms of passion,
Mhm. Mhm.
emotion, and I don't sense an emotion here. I think
Yeah,
it's just very,
it's
ex
very serious.
very
It's
serious.
severe. It's not, like this is terrible. Everyone run around. Like it's not
Yeah,
creating panic, but it's serious. It's like it almost seems like it's grave or something.
right,
Like
right.
it's a serious situation. But yeah, you're right. Not the most like opinionated tone. I don't know if there's a
Yeah.
different word for that,
I
what
mean,
we're
it's
talking
it's
about.
like a professor telling you, look, we're all, like
It's
this is,
in Yeah, it's informative
yeah, it's
of
important.
a kind of a bleak situation.
Right, right. So,
Okay.
yeah. But I mean, because of that word never, you may want to consider this pretty extreme here, right?
Yeah.
Okay.
So this is significant. This is important, which we kind of introduced before, but Yeah, they're highlighting it again. So, all right, let's see what else we get into in this paragraph. So, these challenges include violence, drug abuse, sexually transmitted diseases, including HIV infection, unintended pregnancy, school dropout, low literacy, and disrupted family and home situations. Okay, so this is a pretty long list of challenges. To me, I'm thinking, I don't want to memorize all these things. I'm going to think of what they have in common. These are challenges that are facing school aged youth. Presumably, based on the last paragraph, that might be higher now than before. Or not even the last paragraph, the last sentence.
I think this
There are
sentence
things to
made it
think of.
clear what, yeah, sorry. I think this sentence made it clear what the last sentence really meant. It's
Mm,
facing challenges across the board. It's not just being unhealthy, right? So
yeah,
that's why it's a unique, that's why the first sentence is really a unique argument in this paragraph because we're just talking about how really you're facing challenges. And those challenges could be health challenges too, right?
yeah,
So, okay.
yeah. But exactly, low literacy is not necessarily a health challenge. You're right. A lot of these aren't.
Right. Low literacy, school dropout. I mean, they could affect your health probably, but
Yeah,
it doesn't
yeah.
directly say that. So it seems like a unique argument here where, okay, these kids are having a tr problem. And that could be the reason why their health is so bad, right? And that's probably the
Mhm.
argument the author is going to make. But
Yeah,
you haven't
but
made
we'll
that.
see.
Yes. Yeah.
Okay, let's look at our next sentence. Ultimately, they translate into significant problems in terms of mortality, morbidity, and social problems. There we go. Yes, you're right.
Right.
So
Now
this is what's causing it.
right, making it clear, look, last paragraph, this generation is particularly unhealthy. Why? Because they're facing challenges. Here are the challenges. And by the way, I know someone's thinking right now, do I need to write down this list? Right?
Yeah.
Violence, drug abuse. No, 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 no. That's a waste of your time. Don't do
Hmm.
that, right? Just understand how it connects to the bigger idea. Understand how the author kind of made their argument, right? Ultimately, what is the most important thing you should know? This generation is unhealthy, right? This
Hmm.
specific generation, this grade school population is unhealthy, right? And more unhealthy than ever before. Uh,
Yeah.
and so that's it. Okay.
Okay. It is important to realize that these problems have implications beyond simply imperiling the immediate health of our youth. So we know that it's imperiling the health of our youth, but now we're saying there's something more. Again, this is to me kind of another sentence that like this is it's a valid sentence, but it's not really that specific. It's cluing me in that there might be something more going on, but it itself is not the most valuable sentence of this passage.
Right.
Like it's a dot dot dot, there might be something more, but that to me is not a sentence that's going to be critical for like the questions.
Right. So it's important to point out that the author is making an argument that this generation's health is really bad, right?
Hmm.
But it's saying that because it's bad, something else is happening.
Yeah.
Right. So we're gonna explain that because I don't think we've ever discussed this before, and this is an important part of the course, our car strategy course, and all of our programs where we discuss how to find arguments within arguments. So let's keep reading and we'll talk about it.
Yeah. Okay. In the short term, they negatively impact educational achievement. So, okay, these challenges have short term effects on education. That is much more specific than just there's other problems dot dot dot. So
Exactly.
short term impacts on education that are negative.
It's so profound. So I want everyone to understand what's happening. The author has said that this generation's health is really bad, right? They're unhealthy. That's an argument. We don't know that. We like there's no way we'll ever really know if their health is really bad, worse than ever before, right?
Yeah.
So that's an argument. But then the author is saying because of that argument, because there's an argument that we can kind of fall back on, there's another argument. Because their health is so bad, their educational achievement is also negatively impacted, right?
Hmm.
We can't make this argument without the previous argument. And so what we call this in our course is an add-on. It's an
Hmm.
additional argument right? On top of the current argument we have, right? It's more, and usually the add-on argument is more important. This is more important because it's more specific, like you pointed out, right?
Yeah.
And so again, this is an argument on top of an argument, right? Which is insane because if you think about it, the author is the reason why this is so important is because the author is really trying to convince you that they're right, right? That their argument stands by suggesting other arguments that fall through that fall in line because of that original argument, right? So it's
Mhm.
the author's way of making their argument sound more solid, more concrete, right?
Yeah.
So we have to be aware. We have to be aware that this is an argument that is only happening because of the previous argument, right? We have to
Yeah.
understand how they relate to one another. Okay.
Yeah.
All right, cool, cool. Let's keep going.
All right. The next sentence says, in the longer term, they have significant social and economic impact that affect future well being and prospects for a fulfilling life. So we just had talked about the short term negative impact on education. Now we've got impacts on the long term that impact social and economic well being, essentially. Um, so this is now the other side of the coin. This is the longer term issue with these health challenges that we face early on.
Right, another add-on because
Hmm.
now we're not just talking about the short term, we're talking about the long term, which is social and economic well-being being impacted, right?
Hmm.
Again, the bigger parts of this paragraph are not that the school age population are unhealthy. It's that the unhealthy school age population leads to, in this case, poor education, poor social and economic, you know,
Yeah.
state well-being. And so that's what you
Mhm.
need to keep track of. That's really, really important here.
Yeah, absolutely. So that's what we should be pulling out of a paragraph like that. Let's look at what is this? Paragraph number 4. It says, ultimately, the implications are even broader than the individual student risk. Okay, are we going to keep making this more and more broad? That's my question. Again, this is a sentence that doesn't give us that much individually, but it's kind of setting up potentially another layer to this argument. So, even broader than individual students, dot, dot, dot. Like, tell us how. Gets me on the edge of my seat, but doesn't really give me much to go on.
Yeah. Okay.
Okay, as indicated in Code Blue, quote, the crux of this emergency is simply that far too many of our teenagers have lost their way and are engaging in destructive behaviors that imperil their immediate health. So it sounds like we're talking about the issue that we've already set up, the challenges, right? They're harming their health. Um, Sounds pretty similar to what we talked about
Yep.
before.
Yep. Very general, very broad still.
Hmm. And it's still seeming like we're focused on individual students or individual teenagers. So maybe they'll bring it to a broader point in the rest of this quote. Because the quote continues, by the way, for those of us who are just listening. So the quote continues, it says, this crisis is not, as some people believe, confined to communities that are suffering from poverty and crime. So perhaps it's broader than just poverty and crime's impact on society. So it's not just limited to one tier of socioeconomic status.
Yeah.
Okay, so it's broader. Again, we're kind of hitting at that first sentence, but I think we'll keep going. The quote has one more sentence. It says, and it goes beyond a concern for individuals, for when so many of our young people are affected by poor health or are engaging in risky behaviors, it is the country as a whole that is at risk. Ooh, okay. I feel like the last sentence made this a little more clear. The whole country, everyone's at risk from these teenage challenges.
Right. It's not just central or located to specific populations within the community, right? Like
Hmm.
like segments of the population. It's the whole country that is at risk because of this issue. So again, this is the author trying to make it sound more dramatic, right? More extreme than it really probably is, but who knows, right? Author, this is super serious, right? Again, like very detrimental, right?
Hmm.
To the whole population. Okay.
Yeah. Yeah. So wide impacts. It impacts the whole country. Okay, let's look at paragraph number 5. It says a relatively small number of preventable health problems account for the leading causes of mortality, morbidity, and social problems among young people. Okay, so it sounds to me like we're saying the biggest health concerns are preventable. There are only a few of them, and they're mostly preventable. I don't know what these preventable health problems are, but it does seem like we're stating that there are only a couple and they are preventable.
Yeah.
That feels relevant to our topic because we've been asking or we've been establishing this health challenge in teens as a major issue. We just said the whole country's at risk because of this. Now it
Right.
seems like again, these things are preventable. Maybe this is
Giving
going to
us a
lead to
light. Yeah.
a future argument.
Yeah, giving us the light at the end of the tunnel, right? Because like so far everything has been dire,
Yeah.
has been very depressing, but now the author is trying to say, okay, this is preventable. And that's an argument because some people may think this isn't preventable. There's nothing we could do about it.
Hmm.
Okay.
Yeah. Let's see if we get more detail about that, because that was a pretty broad statement. For example, nearly three-fourths of deaths among those ages 5 to 24 are from motor vehicle crashes. So 30% of all deaths. Other intentional in unintentional injuries, which is 11%, homicides, which is 19%, and suicides, which is 11%. So it sounds like, especially given the for example, the author feels that this list of causes of death possibly are preventable. Um, they're saying, for example, as like this is going to help me show what I'm trying to communicate. So we just have a bunch of data about what is causing problems among young people.
Yep. Sounds
Cool.
good.
Um, all right. So let's see. Many of these problems can be prevented.
There you go.
Short and sweet. There we go.
Yeah, I was assuming that, right? But so
Yeah.
far that wasn't as clear in that second sentence, but now it's obvious. Like these are preventable problems, right? That
Mhm.
young people have. So okay, great.
Wonderful. Okay, so again, that idea that these problems are preventable is pretty well established now in this paragraph. Additionally, according to Simon Hoffereth, quote, many of the 1 million adolescent pregnancies and more than 10 million cases of sexually transmitted diseases among persons ages 15 to 29 are preventable. So now we've got more preventable illness and challenge, according to this individual Hoffereth. But again, preventable. I think we've
Right.
mentioned that word like 4 or 5 times already in this paragraph.
Right. That's the whole theme of this paragraph, and that's the argument. But then now the author is pointing to an authority figure, some person,
Yes,
right? That
Hoffereth.
that kind of that kind of is alluding to the same thing.
Hmm. Even more support for their argument. Okay, last sentence of paragraph 5. It says also preventable are the alcohol and other drug use that is associated with many of these problems. There we go. There's another preventable. It's seeming to me like this idea of prevention is possibly pretty important to the author. What do you think?
It does in this paragraph. We don't know. I wouldn't call it the main idea just yet,
Yeah,
right? I mean, so far the main idea to me would be something about how this generation is particularly unhealthy.
unhealthy. Yeah,
That
I was
seems to
thinking the
be
same.
the big thing, but there could be two arguments that the author cares about, right? So
Hmm.
far, I would say this is a very local argument to one paragraph, but if it does repeat in the next paragraph, I would consider it to be part of the main idea as well. But one thing
Hmm.
I would track is that person, right? Simon Hoffereth. I would make sure okay, that person came up, and that person was tied to this idea of how this is all preventable in that fifth paragraph,
Yes. Yeah, I don't know if it's the main idea, but it just was brought up so many times in paragraph 5. So
right?
let's see paragraph 6 and see what direction we kind of finish up in. This is our last paragraph. Among adults 25 and older, the three leading causes of all deaths and significant morbidity, heart disease, cancer, and stroke, account for 2/3 of those deaths and significant morbidity. Okay. Uh, More details, basically, more statistics. Um, I'm waiting to see if we're going to talk about prevention with these, but right now all we know is the data. Pretty general.
Okay.
Okay, let's see. Our next sentence says each of these is subject to significant reduction through prevention, especially if one can start with teenagers. Okay, so now we talk about prevention. And one thing that I didn't expressly point out, but is kind of being highlighted here is we're talking about 25 and older. So we're talking about health problems in older individuals. And now we're saying prevention, back to that idea from paragraph 5, but especially if you start when they're school aged. So there's some benefit for early prevention, basically, even for health down the line, kind
Right.
of
Right.
fitting
I
with
was
the theme.
tracking. Sorry, go ahead.
Oh, no, go ahead. You're good.
Yeah, I was tracking 5 to 24 years old, and I would visualize all these things because I'm like, yeah, motor vehicle, unintentional injuries, homicides, suicides. That's all paragraph 5. This
Mm-hmm.
paragraph, they're older, right?
Mm,
I don't know why the author's doing this. It's kind of weird because we've been talking about teenagers and
mm-hmm.
grade school students really. But overall, the author did point to how this is affecting the country as a whole, right?
Mm-hmm.
And so this kind of relates to that. So just
That's what I was
understanding
thinking.
again that prevention could start even, even in teenagers, this could lead to less in adulthood, right? That's I think the point that the author's trying to make here. So
Yes. Yeah, absolutely. So intervening in teens might be an advantage thing or an advantageous thing. Okay, for example, with specific reference to cancer, Dr. John Seffrin, Executive Vice President and Chief Staff Officer of the American Cancer Society, has indicated that, quote, if everything we already know about primary and secondary cancer prevention were only taught and applied universally, we could reduce our cancer deaths by 50 to 60%. End quote. This is the last sentence of the passage. So it sounds like we have another person to track Seffrin, Dr. Seffrin, and is basically saying that prevention could reduce cancer mortality. So prevention or education could help with cancer as well.
there you
It's
go,
just,
right?
yeah,
Cancer
further
prevention.
supporting that idea.
Yeah, we're only taught and applied universally, meaning earlier on, right? Like dealing with it earlier on. So again, this is
Hmm.
all affecting teenagers because of
Hmm.
eventually they're going to become older and they're going to, potentially have these issues that when they're
Yeah.
25. So it's all related, right? And so I
Hmm.
would say that prevention is probably a main idea argument because it's in the last two paragraphs, right? It's
Yeah.
repeating in the last two paragraphs. And that's unique because sometimes, most of the time, we've seen the argument come up in the middle of the passage or earlier on in the passage repeat. But now it's just the last two paragraphs, right? So I would say the main argument is really twofold. One, that yes, teenagers today are unhealthier than ever before, right? But
Hmm.
most importantly, I think this is even more important, that it's preventable, right?
Yeah.
That most of it are preventable problems. So I would just keep track of those two ideas, and I would be able to probably get most of the questions right now. I would point out, like I said earlier, because this is an easier read, every sentence could be testable, right, to some
Hmm.
extent. So they can trick you, right, with what they've said, what they didn't say. So I would be more careful when it's easier to read.
Yeah. Yeah. And I feel like it's tempting when, when we talk about on a podcast like this, like we're looking for the arguments that are really important. It's very tempting to be like, okay, well, that means that I only have to pay attention to a few sentences and I can completely ignore everything else. That's not the case. We're never completely ignoring any part of a car's passage, right? Like you're not just skimming it over because you don't think it's important. You can't just read it and then immediately forget. You only have to keep this material in mind for 10 minutes for a timed passage from start to finish till the last question, but try and give it your full attention, right? Maybe every sentence is not equally important, but that doesn't mean that you should zone out and forget or, treat it like it doesn't matter. It does. It could still show up in the questions, but again, one of the things that we hope to do in doing podcasts like this is to kind of show you how to pick out the sentences that are much more likely to be in the questions than anything else. So not that you should forget everything else, but
Right. Paying attention, being focused. I think there are two things that you have to do. You have to have the discipline not to pick the wrong answers, right? And that's something that we teach extensively in the course through critical thinking skills, but also focus, right? Like it's really hard to read 9 passages. That's what you have to do for cars, 9 in a row, right? Without losing focus.
yeah.
And so you got to practice that. Use our daily passages. Do multiple every day, right? Because you have a Q bank where you can pick and choose how many you want to do. You could choose like 5 in a row, 10 in a row, whatever you'd like. And so I would recommend just practicing cars every single day, right? And learning these skills. I think that's really important.
Yeah. And actually, just because this podcast is a free resource and because we have so many free resources, we've got our dailies. Like this was one of the daily passages. We have one cars passage go live every day, some science material as well, which is nice. But we also have the full Q bank where you can make your own question sets. And one of the features that I think is really cool about our free question bank is that you can actually sort by subject if you want within cars. So, like if you want history practice, you can get specifically history. Or if you want sociology practice, you can get specifically soc practice, or art history, or dance, or theater, or whatever causes you problems. And we even have some free cars practice exams too that are timed appropriately. So, lots of opportunities to get practice. And even if you struggle in a particular type of passage, we've got resources for you. And I love that those are free and that we can share those, because I think everyone, no matter when you are testing, every single student could benefit from additional CARS work. It's never too early and it's never too late to get started with CARS material.
Absolutely. Absolutely. Awesome.
Awesome. Well, thank you everyone for listening. We hope you enjoyed this episode of our CARS Reading Skills Workshop. We hope to catch you at the next one. Um, Until then, happy studying. Have a wonderful rest of your day. And we hope to see you soon.